Welcome back to Pocket School. Brainstem Auditory Evoked Response. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. This is a little bit complicated topic. I will try to simplify it. First, starting with what is brainstem evoked responses. So, this is how the brainstem auditory responses are recorded. Electrodes are placed in the central region and at the ear A1, A2 or on the mastered process. And when a sound is clicked at the ear, action potentials produced at the various parts of the auditory pathway are recorded. And this is how the evoked responses are recorded. So, auditory evoked potentials are electrical potentials generated by auditory pathway in response to auditory stimuli, usually clicks recorded using scalp electrodes. It is something similar to what is being done in the EEG. They reflect the neural activity from cochlea to the auditory cortex, and it will help in assessing the auditory pathways. So, it is similar to recording of EEG. Sound is clicked either in the mono-oral, either on the right ear or followed by left ear, and then the action potentials produced are recorded just like that of how the ECG is recorded. One at the central sees it and other at the earlobes, right and left, or in the mastered process. Hope this is clear to you. Now we go into what are the types. Depending upon the time duration, you divide into the first 10 milliseconds. It is the short latency. And the 10 to 50, this is 10 milliseconds. 10 to 50 is middle latency, and more than 50 milliseconds, it is long latency. And this is not clinically much relevant. So we are concerned with the short latency auditory evoked responses. So I will repeat once more. When the sound is produced, action potentials are recorded from various parts, or action potentials produced in various parts of the auditory pathways recorded. The first 10 seconds or milliseconds, not seconds, 10 milliseconds is the short latency, and that is called the, usually mentioned as the brainstem auditory evoked responses, or BAER. So we will go into bit on the auditory pathway. So here it is the cochlea. The sound is produced. It is passing through the auditory nerve, and then it reaches the cochlea nerve or the cochlear nucleus. Action potentials are produced from the nerve and also in the cochlear nuclei where they are relayed. Majority of the fibers are crossing out to the opposite side into the superior olivary nucleus. From there, the fibers are going upwards to the inferior colliculus situated in the midbrain. Inferior colliculus of the midbrain. And from the midbrain, it is passing to the thalamus, that is through the medial geniculate body. From there, thalamo-cortical pathway. Some of the fibers are passing ipsilaterally also. And this part is called the lateral lemniscus, that is from the superior olivary nucleus going upwards to the inferior colliculus is called the lateral lemniscus. Should not get confused with the medial lemniscus, which is the great sensory depreciation followed by the ascending of the sensory pathways. So let us look into the waveforms that is formed. There are mainly 7 waveforms can occur. So we'll look into the most important one is the fifth wave. 6 and 7 are not clinically much relevant, so we are not concerned with it. So we'll go for the first 10 milliseconds and how the waveforms are generated. So here you can see the cochlear nerve, the first wave is from the cochlear nerve, cochlear nucleus, then the superior olivary nucleus, then the lateral lemniscus, and finally from the inferior colliculus. So that is how the waveforms are formed. Even though it is easy to say, these waveforms are difficult to differentiate. So I will repeat once more. The auditory nerve forms the wave 1, cochlear nucleus in the brainstem, wave 2, superior olivary nucleus, remember SON, superior olivary nucleus, the wave 3, and 4 is by the lateral lemniscus, and 5 is the inferior colliculus in the brainstem, that is midbrain. So the cochlear nerve followed by the nucleus, then the fibers in the superior olivary nucleus, then the lateral lemniscus to the inferior colliculus, from there to the medial geniculate body. Wave 1 is occurring here, wave 2 is in the cochlear nuclei, wave 3 is in the superior olivary nucleus, wave 4 is in the lateral lemniscus, and the wave 5 is in the inferior colliculus of the midbrain. I will draw it in a diagrammatic way. So wave 1, this is auditory nerve. Wave 2, the cochlear nucleus. Wave 3, remember it is superior olivary nucleus. Wave 4 is lateral lemniscus, and wave 5 is inferior colliculus. That is the brainstem auditory evoked responses. Even though it is described like this, the waveforms are difficult to distinguish. This is from the right ear and left ear. When the clicking is made, the waves are recorded, and there is a lot of noise because of the EEG and other activities, and that is eliminated by averaging, and the waveforms will look like this. Demonstrate with a MRI picture. Wave 5 is from the inferior colliculus. Wave 4 is from the lateral lemniscus. Hope you understood the various forms. What is the usefulness? The latency. What is the latency? That is the distance between the waves. The 1 to this is 1 is from the cochlear nerve, 5 is from the inferior colliculus. This latency is increased. That means patient has got a brainstem problem. When the waves are absent, that indicates that the wave 1 is present, and the 2 is absent. That means there is a problem in the nerve or the nucleus. But again, remember, you cannot assess the higher cortical functions. It is dependent on, and the waveforms are dependent on various other factors. So that's the problem with the brainstem evoked response. Here you can again see the little more enlarged view. So here is the clicking, the stimulus, auditory nerve, wave 1. The cochlear nerve nucleus, wave 2. Superior olivary, wave 3. And the lateral lemniscus, 4. And the inferior colliculus, 5. So fifth wave is the most important or prominent wave that you are going to see. It is the fifth one. Okay. So what are the uses? This can be used in infants. That is the patients. The cooperation is not needed. Somebody with a child with a hearing problem, you may test it. Second, patients with a coma to identify the brainstem function. Third, somebody with a brainstem lesion like multiple sclerosis. Fourth, it can be used in diagnosis of CP angle tumor. Fifth, during neurosurgery to assess the brain function or dysfunction that is occurring during surgery. Hope you understood. So today we have discussed how to record the brainstem auditory evoked responses. We are divided into early, middle, and late latencies, and the first 10 milliseconds is the most important. The waveform, fifth is the most prominent one, and the one is from the cochlear nerve. Stay tuned for further videos. Thank you.